What is the difference between a panic attack and an anxiety attack? Are there any differences? And if so, what can you do to actually stop it when those occur? Those are the questions that I'm going to be answering for you today. Before we get started, my name is Dr. Vanessa Milagros for those of you that don't know me. And if you enjoy mental health content like this, I would ask you to consider subscribing and liking before the end of this video. Let's jump right into it. So an anxiety attack is a sudden, intense fear that happens based on a situation. During an anxiety attack, you may experience rapid heartbeat, shortness of breath, dizziness, sweating, or feeling really overwhelmed. It can vary between duration and intensity based on a number of different factors. But with anxiety attacks, the symptoms generally tend to subside based on the trigger or the situation subsiding as well. So something occurs that triggers a response from you, and that is an anxiety attack. But after the situation has either calmed down or it's been some time in between, your symptoms also subside. So although it may feel like, a lot of people say, like I'm dying, those symptoms do subside over time. Now, although anxiety attacks and panic attacks have generally the same definition, they have major differences in between them. So yes, there are differences between panic attacks and anxiety attacks. And the main specific one is the fact that panic attacks happen suddenly and without warning. There's no, oh yeah, that situation triggered my anxiety attack, and so that's why I'm feeling this way. It could happen at the grocery store, while you're minding your own business, when you're not doing anything, or when you're in the middle of doing the most important thing in your life at the moment. It does not care. And that can actually be really intimidating and scary because it impacts a lot of individuals, so much so they fear going into a lot of situations just based on the fact that they don't know when the next panic attack is going to happen. And that can be really, really fearsome and impede on a lot of people's daily life. So imagine being fearful of not knowing when something is going to happen, that you're not going to be able to control your body, your mind, or anything. It feels like you are outside of yourself. And like most people have said, it feels like you are about to die. So it is very, very real. Now let's talk about the intensity and the duration between each. So with anxiety attacks, although the intensity of it is less than with a panic attack, the symptoms can last a little bit longer. So they can last hours, days, or sometimes even longer than that, depending on the situation that triggered that anxiety attack. Also, the other stressors in life that continue to impact that. So it's dependent on a lot of things, but it's less intense than a panic attack. Now, with panic attacks, because they're sudden and you cannot plan on having a panic attack, it just happens and there's no real, yes, this is the reason why. They tend to be more intense and peak at the highest very quickly, but also can come down just as quickly, often within 10 minutes or so. So it can go anywhere from 10 minutes, but it can last 20, 30 minutes, sometimes even a little bit longer than that. Now, this is dependent on the situation. And you say 10 minutes and you're like, oh, that's nothing. When you're in it, those 10 minutes don't feel like 10 minutes. Now, the aftermath of panic attacks can last a lot longer than just that. Now let's talk about some of the symptoms that come with each. So with anxiety attacks, some of the symptoms include worry, distress, fear, restlessness, and other physical symptoms such as increased heart rate, sweating, and stomach pains. Now with panic attacks, this can actually involve more severe physical symptoms such as chest pain. Maybe there's a sensation of being able to breathe, so like choking sensation, derealization, so feeling as though you're detached from reality, that fear of dying, and then there's also impending sense of doom. Now let's talk about the onset. So with anxiety attacks, there's a gradual buildup of that. So things happening little by little, you're not managing your stress, you're not doing what you should be doing for yourself, and life keeps lifing, things keep happening, stressors keep happening, you're not managing or working on them, you're ignoring and pushing them aside, still going full throttle for everyone else. Eventually, that last thing that you would think, oh, that shouldn't be a reason for you to have an anxiety attack, it's usually not. That trigger, that situation was the straw that broke the camel's back, so to speak, the cherry on top that you don't want. That was what set off everything. But it's a gradual experience. And if you need help with developing a self-care routine where you can learn to put back into yourself, check out my free 7-day self-care guide for those who do not have the time. It's linked in the description below, and it's my free gift to you. Now, the onset with panic attacks, like we mentioned earlier, it's sudden, there's no warning, it happens. When it happens, where it happens, it does not matter where. Let's talk about some of the underlying conditions of each. So with anxiety attack, these are usually associated with other anxiety disorders such as generalized anxiety disorder, social anxiety disorders, and others. I actually have a full video explaining what generalized anxiety disorder is, and I'll place it right here for you. Go and check it out after this video. Now, if you have experienced panic attacks, this usually is tied with a panic disorder, but it can also be in conjunction with anxiety, depression, and other symptoms such as that. So it doesn't necessarily have to be tied with a diagnosis, but most times it usually is, and it's a byproduct of a full panic disorder. However, you would need to meet with a therapist or another medical mental health professional to get that diagnosis and to really start to work on that. Let's talk about 5 things you can do to help you stop or reduce the symptoms of an anxiety or panic attack. Number 1, practicing deep breathing. Now, this is going to be important to start to practice before then. That way, when you do experience panic or anxiety attacks, you have a better sense of what to do. Now, when you're in it, it's very hard to think logically. However, if you start to practice beforehand, you can have that muscle memory, so to speak, to where you can practice that hopefully during the time that it happens. And this is important because practicing deep, controlled breathing helps to regulate your body's oxygen levels and really helps to calm your nervous system, which is going to be imperative in those times. Remember also that even if you're not the one who experiences these attacks, you can help somebody else who is currently experiencing this by just watching this video and understanding what you can do to help. Now, this is how I want you to actually practice this. I want you to practice breathing in through your nose, close your mouth, inhale through your nose. Do it with me. Ready? Go. Hold it for a few seconds and then release through your mouth. And repeat it again. In through your nose, hold for a few seconds, out through your mouth. Repeat it over and over again until you start to feel a little less anxious. It's helpful if you're the one helping somebody through this to help say it for them and say it with them and even do it with them. All right, we're going to breathe in. Let's breathe in together. Breathe in. Hold it for a few seconds and then breathe out through your mouth. And doing that with them so they don't feel alone. The next tip is to practice grounding techniques. Now, grounding techniques are really useful because it helps us to remain present in the now, in this moment. An anxiety or a panic attack, it feels as though you are having an out-of-body experience. And so to help reduce this, grounding techniques are really going to help. Here's one that you can try. It's called the 5-4-3-2-1 method. And this is how it's going to go. You are either going to identify or somebody else is going to help you identify 5 things that you can see within the room or the space that you're in. Identify 4 things that you can touch, whether it's the seat underneath you, the floor, the grass, someone's arm, whatever it is, 4 things that you can touch. Identify 3 things that you can hear. Can you hear the cars passing by? Can you hear the birds chirping? Can you hear the wind? What can you hear? Identify 3 things. Then you're going to identify 2 things that you can actually smell. What can you smell? Is there food cooking? Is there trash nearby? What is around that you can actually smell? And then 1 thing that you can taste. Something that could be really helpful is if you have Jolly Rancher or something where you can taste something different, a Listerine strip. I wouldn't necessarily recommend anything that could be a choking hazard. Maybe a Jolly Rancher won't work then. Maybe a juice or soda or water, lemonade, something that you can taste. And it could be something that could help ground you, bring you back to the present moment. That's going to be really helpful. And what this does is this actually starts to slowly distract you from the anxiety because that's increasing the symptoms because you're still in it. But it helps to slowly distract you from it and helps reduce those symptoms little by little. And it does take time, so be patient, please. The next one is positive affirmations and reassurance. This is going to be great if you have someone with you, but if not, you can still do this. I want you to counteract the anxious thoughts that you have in the moment or help someone do that. Because remember, these anxious and fearsome thoughts are fueling your anxiety attack or your panic attack, and they're fueling those symptoms. So you're going to want to do the opposite of it. This restores your sense of control and reduces your sense of fear. So here's what I want you to practice. I want you to practice telling yourself, I am safe. This will pass. I can handle this. I am okay. I want you to repeat those things again and again and again until you start to feel those symptoms diminish little by little. The fourth one is to practice progressive muscle relaxation. And I particularly enjoy this one because it helps to reduce the tension that you're physically carrying with you. So what I want you to start to do is to actually practice this. And I'm going to sit so I can show you, and you're going to practice with me if you can. What I want you to do is start with your toes, and I want you to close your toes in and then hold it there and then release. You're going to take the next muscle, which for me, I just classify as my calves. So I'm taking those and I'm going to squeeze as much as I can, right? For 5 seconds. That's my goal. 5 seconds. 1, 2, 3, 4, 5. And then release. Then the next group, thighs. Try to squeeze as much as you can for 5 seconds and then release. Work all the way up from your toes, all the way up. That helps you to relax. Be intentional about all the stress that you're holding on to. Do you hold it onto your shoulders? Is it your neck? Is it your back? Where is it that you hold your stress and anxiety? When you practice progressive muscle relaxation, it helps you to be intentional. Try it and let me know what you think in the comments below. Last but certainly not least, we're going to practice visualization. So in those moments, I want you to have a space where you can see in your mind that is safe, that is calming for you. Maybe that's a place that you've been to. Maybe that's a place that you dream of going to. Whatever that place is in your mind, I want you to visualize it and visualize you being there as much as you can. This can help shift your focus from where you're at with the anxiety or panic attack and take you to a place where you feel safe, where you feel calm. So I want you to think about that place. I want you to close your eyes. I want you to envision yourself being there, what you see, what you hear, how you feel. I want you to think of all of those things and picture yourself being actually there. And you don't have to do all 5 of these. You can definitely just pick 1 or 2 or 3 that you enjoy and practice doing it in the moment. Or if you're with someone helping them through this, you can pick a few that can help them through it. The goal is not perfection. The goal is just practice, especially if this is something that's reoccurring for you, experiencing these panic attacks. I want you to practice this when you're not in that state. That way, when you get there, you at least have the tools that you need to know how to mitigate this. Also, my recommendation is always seek mental health professional support through this. That way you can work on understanding what is actually going on here. Are you doing something that is increasing the likelihood of continuous anxiety attacks? Are you not addressing your self-care needs? Are you not addressing your past? Are you not working on things on the outside to help reduce the stress that you're experiencing? Or is it something that is out of your control? And if so, what do you do about that? There's so many different things that you can explore in therapy that will help you through this, because you don't need to live a life fearful of when is the next anxiety attack going to hit? When am I going to have another panic attack? I can't do anything just in case. There are resources out there to help you. You are not alone in this. I hope this video has been helpful for you. If something that I shared here was beneficial to you or you learned something new, let me know in the comments below, or consider sharing this with a family or a friend who may also find it helpful. Thank you so much for being here. I want to encourage you to watch this video right here next. See you there.